how do you insert the right analysis and right research at the right time? And how are you ready ahead of time? Like, I spent a lot of time thinking about what are the questions that eventually are going to come up and are important, and how can we now generate some good analysis and research to help answer those? That's a challenge, right? But I think what's really encouraging, and I've observed this group, and just a congratulations to kind of both of you, is you've kind of been plugging away, and where there's opportunities that pop up, all of a sudden now you have a storyline and you have some important analysis and research to show. But anyway, let's get into it. And I do a lot of presentations to a lot of different audiences and a lot of different people with a lot of different interests. And I've increasingly started kind of putting this slide up. We all kind of are susceptible to this, wonky economists included. So I'm going to actually highlight some areas where I think data are kind of inarguable in terms of what the facts say, but I'm going to also show how there's very different interpretations and how people use that. But the reality is we all look at data with different views, and we get so jazzed up about data that supports our worldview, and then we kind of hope other data that doesn't goes away. For someone in my field, that's not kind of how we work, so I'm trying to just put the best information out that helps answer some of the important policy problems. So let's get into this. First thing I want to show you is just trends in dental care visits. And it may be a little hard to see, so basically there are 3 age groups on the screen here. Children on the left, working age adults, and then older Americans on the right. And this is just the percent that visit a GP dentist. And what we did here was we split it by income level. So the gray line is the high income population, higher income households, and the yellow line on the bottom is low income households. And what I want to what I think is important to take away here is kind of look at the left and the right panels, which are children on the left and older Americans on the right. And the data are very, very clear here that income disparities in dental care visits are actually narrowing for children pretty slowly and steadily, and they're actually widening for older Americans. And for the adult populations, they're relatively the same. So again, some people will take the last year of data and say, oh my God, there are huge disparities. And some people will say, well, let's actually look at trends over time, because we started with some situation, right? And then let's see where we're going. And my take there is that, well, for children, we're actually doing a pretty dramatic job of narrowing those income disparities. Again, this is one measure. Did you visit a general dentist last year? And we could talk about why we're narrowing those disparities. A lot of it is just good policy with CHIP and Medicaid, and more pediatric dentists and other things like that, and more prevention. But we've kind of gotten policy, I would say, largely at least going in the right direction on the kids side. But it's very important. For seniors, we are seeing in the data very clear widening disparities. The difference between what low-income seniors are achieving and high-income seniors, that gap is growing. Here in the case of dental visits, for outcomes I'll talk about in a second. Bruce did not have enough time. He is an expert on this much more than my team. But I will just give my take on kind of the oral health outcomes data. And this is just one chart. This is untreated caries. This is for the senior population only. And it's over time. And it's by income group, right? So each of these 4 buckets is going from low income to very non-low income. And each of the different colors is trends over time. And you do see kind of untreated caries falling, but not for the low-income groups in the last couple waves. Now, I don't know if the updated data, I actually didn't get a chance to talk to Bruce. I don't know if this has been updated. We haven't with the latest NHANES wave. But generally here, what are you seeing? You're seeing, at least in the last 2 waves of the NHANES there, or the previous 2 waves, no appreciable change in untreated caries rates for low-income seniors, while we've seen reductions for high-income seniors. Bruce did a great piece on tooth loss in JADA. Similar kind of thing. We're seeing progress in terms of fewer older Americans edentulous, more teeth retention. But again, in that paper, it was very clear the gains have been much bigger in the higher income populations than in the lower income populations. So again, the data are telling a story about, again, low-income seniors are not seeing the same level of improvement of oral health at all as higher income senior groups, right? And that's very different than children, and I think it's important to kind of contrast those because we kind of have a policy experiment in the U.S. of how we've treated oral health for kids versus other age groups. And I'll talk about that before the end.
Probably the best thing.
And here are some data. I've presented this a few times. It's a little hard to see. We have fact sheets on our webpage and stuff. Actually, let's get to, well, no, I will talk about that. These are self-reported oral health outcomes. We have a very large data set we generated in 2015, and we've analyzed data separately for seniors. I won't talk about this too much, but you could look at kind of, again, those income disparities, right? So if you look at just the bar charts on the right, you do see kind of these self-reported outcomes also vary significantly by income. Okay, so this isn't new, it's just confirming a lot of what the other stuff has said. These data we don't have time series on. We're kind of the first to generate nationally representative data of this nature, of self-reported oral health status, and a lot more on attitudes. But again, just underscoring this issue of we are seeing very different trends. Now that's what the data say. Whether we think that's a problem is very different. That's a value judgment. That's not for economists to help out with. It's for all sorts of stakeholders to comment on. But in terms of the facts and the data, it's pretty clear where the trends are going. And they're very different for low-income populations of older Americans versus higher-income populations.
And that's the only angst
okay.
I get.
And this, again, is a little difficult to see, but this is out of our new HPI annual report that we launched. It was kind of cool. We reorganized data. So what we're doing here is we're taking basically foot traffic in general dentist offices. So these are patients. Or this is people who visit a dentist, and we're comparing kind of what's been happening over time. And I guess it's a little hard to see, but if you just focus on those orange bars on the two right panels here, basically what's going on in America? There are a lot more older people, right? A higher share of those older people are visiting the dentist, driven by the upper income groups entirely, right? And that's basically shifting the composition of patients in dentist offices, right? So when you look at the population visiting the dental office, there are actually fewer working age adults in dental offices today than 10 years ago, right? So the population of adults has grown, but their utilization rates have declined so much that just the number of adults in dental offices has actually fallen in the US over the past 10 years, right? The number of kids has stayed roughly the same, right? Their utilization is up and there's been shifts in insurance coverage. So I actually think there's been a small increase. But the number of older Americans in dental offices has increased dramatically. Right? It's gone from 14 million to over 20 million, okay? So this is a slide I put up just because it's very important, right? There's an important, and the Congresswoman nailed this one, right? Look, I've been in this field 8 years. My observation is there is not a unified view on oral health by all the stakeholders who touch oral health, right? There's been a tremendous effort to get many stakeholders together. This group's been part of that. You said what, Mike, 85 signers of the latest kind of letter? So that's amazing. But she gave a clear marching order, right? She said in 2020 when this report comes out, you better have a very concerted kind of ground game to basically take the same talking points, that's what she told us, right? To your local grassroots politicians, to testimonies, etc. And I would argue we don't have that now. Where am I going with this? My point is there's a clear political economy here, right? This is the reality that seniors or older Americans are making up a larger share of patients today in dental offices in a world where many segments are shrinking. When we switch that to money, right, this is now looking at dental spending over time according to age and insurance status. And all I want to do is to show you the seniors on the right have been basically driving the dental economy's growth, and other sectors are shrinking it, right? So when you take these utilization trends I've showed you here, and you switch it to foot traffic, you get this. And when you switch it to dollar terms of dental spending, my point here is that the seniors are basically the only demographic that is kind of booming in dentistry, right? And a significant share of them are out-of-pocket patients, right? And so that's a reality, I think, that needs to be appreciated from, like, let's say, a grassroots provider perspective, especially providers that don't play majorly in Medicaid or insurance, right? If you're primarily a private practice that has cash pay patients, seniors are likely going to be your main engine, at least in aggregate, right? I'm not talking individually dentist by dentist. But this is very important, and I think this is partly what spooks some providers, right? Is that an expansion of public coverage, well, wait a minute, my cash pay senior population is the only real booming segment in dentistry. It's probably, and I've never run a dental practice, but it's probably subsidizing some of my insured populations, or maybe if I'm a Medicaid provider, I have higher margin here and I can afford to take Medicaid because of that. You know, the clinicians in the room know much better about this, but this is a reality, and it is something that spooks providers, especially those that are dealing in a high-income, cash-pay senior population, right? So that's something that has to be managed and recognized, and I think that's some of the angst within, within folks like the ADA and other provider organizations, and it's a reality. I mean, this is not to blame anybody; it's just this is the economics, right? And here's the data. I mean, you know this. Look at the difference in how dental care is financed for different populations, right? So again, this is a result of policy, but I tend to focus on the right pie too. That 2/3 of spending among seniors for dental care is out of pocket, right? Okay, now what would a Medicare benefit do on the positive side to an MBA running 30 dental practices? Right? Or to a large dental group run by dentists. I didn't mean to say MBA in that sense. I don't want to start another debate here. But tell me, what's a potential positive when you look at a lot of these trends here? Right? What would a benefit do? So it'd bring a lot more patients in, right? So depending on, and I saw Rich is here at Mansky, I saw, yeah, Rich is. So Rich has done a lot of seminal work on this, right? So depending on what evidence you want to look at, there's elasticities that differ, but the trade-off is that to a business person running practices, it's more foot traffic, right? But it's a different kind of foot traffic. It's not a cash pay high income population, right? It's somebody covered by a public program, and you got to look at that. So I think that's the reality, and I think that's where we need to actually push more of the debate. And within the ADA, I kind of think that's where the debate needs a bit more evidence and fleshing out, and we're trying to help that out. But it is the reality, and it needs to be kind of recognized on this. Okay, I just want to end finally with a few things on what older Americans say are the main barriers to dental care. And this is the second slide where I want to be very, very blunt on how people see very different things from the same data, right? So this is self-reported. This is data we generated, again, through that very large research effort. If you didn't go to the dentist last year, what did you say was the main reason why you didn't go, right? And the idea here is that cost rises like to number one for everyone except the higher income populations, okay? So there are different ways to interpret these data, right? Some people look at this and say, well, okay, that's just people not prioritizing it, right? You say, you can't afford this, but you're wearing $400 shoes, or you're paying for cosmetic procedures, or you're going on vacation, or you're living in a really nice house, right? Not my problem. Your priorities are what they are. We don't need to intervene, right? That is one viewpoint. Another viewpoint is saying that healthcare services that we argue are core and are essential and are part of wellness should not be treated the same way as other discretionary spending items like shoes and that. So let's go to healthcare, and let's compare dental care to other healthcare services, and let's look at perceived affordability there. And that's what this chart does out of an article we did in Health Affairs. It's basically asking the population, were there times when you needed certain types of healthcare services and you did not get them because of affordability challenges? And now let's put dental care against other healthcare services. And that's what this survey did, right? And what we show here is that within the healthcare world, dental care certainly has a perceived affordability or value proposition challenge that's much more acute than for other healthcare services. Now, is that because of coverage differences, or is it because of the value proposition, the benefits people think in their heads, right? I don't know. It's probably a mix of both, right? We certainly know that 3/4 of seniors don't have any form of dental coverage. And in America in this day and age, like, insurance is such an important driver of your perceptions and your value proposition, especially post-ACA where we're kind of growing insurance. That sends a signal that, well, it's not covered, it's not important, it's not essential, yeah? But is there also an issue of, okay, it's more important that I get prescription drugs and eyeglasses than dental care? That's probably in the sphere as well. There's more research to be done here, but at least I, as a researcher and economist, to me, clearly there's a perceived affordability issue in dental care among seniors that's very strong, much stronger than other healthcare services, and it is, at least self-reported, the core reason why many, many, many seniors are not accessing dental care, right? And certainly the way things are going now, I'm pretty comfortable predicting that unless we see some big change, this is likely to get worse. And it's likely to get worse because of a lot of research emerging on the older American population. There's a recent report that Kaiser put out, Kaiser Family Foundation, and something that was just in Health Affairs, just looking at medical spending and housing spending among older Americans, and how those issues are starting to consume more and more of budgets, right? And then when you look at asset projections of older Americans, like, it doesn't look great. So in my view, like, the next 20 years, unless there's some change in the cost of care or the perceived benefit of care, we're actually going to see those curves I showed you at the beginning start to widen even faster, right? And I don't know, maybe even we start plugging into the middle class of seniors, and even the higher income may start to have affordability challenge. But that's different. That's projections and my take on the latest research on where seniors' kind of wealth projections are going. Lastly, I just want to end with, we do have some lessons from insurance expansions. And we have a session, I think, tomorrow, later today, with Bert and Meg. Is it today or tomorrow? Okay, you'll talk more about this, right? So I think we have the CHIP and Medicaid experience on reform that shows us what's possible from, I would say, fairly well-designed policy. We have, I would say, an accidental case study with Medicaid expansion under the ACA. It turns out a lot of states that did the expansion happened to have the most comprehensive adult dental coverage. And it turns out that almost 10 million adults, because of that expansion and because of state changes, gained dental coverage benefits. And I just want to show this on the left part. The latest research, and this was ours, about a 3 to 6% bump in low-income adult dental care use due to Medicaid expansion. And then, this is where the Surgeon General is trying to get us to with the report, right? This is not about just teeth and that. Like, look at this statistic on the percent of adults who say the appearance of my mouth and teeth affects my ability to interview for a job, look at those differences according to whether you live in a state with an adult dental benefit or no adult dental benefit. I mean, it's dramatically different, right? So my point is, I think we have pretty good roadmap through the CHIP and Medicaid experience on how to properly design a benefit, largely because of Bert and others people's work in this room. We have this accident, which I'm not going to say is best practice, but we do have some state-level best practices on the adult side. And look, you've all worked tirelessly, and within the ADA as well, we've thought about like what would a properly designed benefit look like, and how would that work. So again, just to sum up, the data are pretty clear on where trends are going and how different they are by income group with older Americans, okay? That's clear. Whether we think as a society that's an issue, different debate, not a place for an economist to comment, other than just being an equal citizen. Affordability in people's heads is a clear impediment, right? Especially to low and middle income seniors, right? I don't see anything dramatically changing that unless something big happens. Like, Medicare benefits certainly would change that perceived affordability challenge. And the last thing is just be, it's important to be cognizant that given that the high income senior population is really the only booming sector in dentistry, among a lot of other shrinking sectors, there's a private practice economic reality here that needs to be managed. I think that's part of where the tension is in this debate. And I think, that's important to recognize. And I think lastly, everybody wants a benefit that benefits the population and, doesn't put providers out of business. And that's, frankly, CMS, I feel, is behind that as well. And I feel there's enough common interest here that, again, having worked through policy and looking at these data, that potentially could have a middle ground, let's say, where all the stakeholders can get on board, and that's what you're trying to do. So I'll end there and hand it off to Allison.